All age groups are important, but particularly the very young. There's a lot of bang for your buck in essentially 0 to 5, 0 to 10. Spend money there. It's a good investment on preschool education, on access to parks and recreation, on education of parents, on supporting schools and school health. Spend your money there. Don't wait until it manifests itself in disease. Land use policy is critical. Looking at the social fabric and the degree of social isolation in neighborhoods needs to be focused. There are new challenges brought on by global economy, climate change, U.S. foreign policy, immigration reform, the need for energy alternatives. These are opportunities. These are moving trains that we can get on in this work. We have to work on changing community conditions and have to move away from trying to berate people about individual behaviors. Next slide. Okay, keep going. And finally, internal capacity building. Go again. This is really looking at ourselves as an institution, trying to figure out who we hire, how we set goals, how we're answerable to our communities. We're trying to improve our practice, make sure our staff understands what we're doing, develop a shared vision, develop future leaders. It's very critical to this work, and raise staff awareness. Next slide. We have a series of trainings. Next slide. We have this Public Health 101, which is very unique. We've actually exported it to a number of places around the country that has been modified by different health departments. Looking at the history of public health, looking at cultural humility and competency. Module 3 is undoing racism, very focused and explicit strategy to try to make us an anti-racist institution. Looking at health status and equities in Module 4, the social determinants of health, and Module 5 is community capacity building. Next slide. Race, the Power of Evolution, another product by California Newsreel, who produced Unnatural Causes, a very important tool in deconstructing the myth of race. Next slide. And finally, the World Health Organization says you've got to do 3 things. It says, 1, you've got to improve the conditions of daily life, the circumstances in which people are born, grow, live, work, and age. That's place. You've got to tackle the inequitable distribution of power, money, and resources, the structural drivers of these conditions of daily life, globally, nationally, and locally. That's policy and practice. And you've got to measure the problem, evaluate action, expand the knowledge base, develop a workforce that is trained in the social determinants of health, and raise public awareness about the social determinants of health. Next slide. Skip that. So finally, lessons learned. You've got to take small steps in this work. You've got to match your resources to your goal. You have to address the isms. And conflicts will occur. If you're not having conflicts, you're not doing something right. You've got to prepare yourself for them. But this is charged. People get heated about this, and that's good. Not great, but it's good because people are being honest. You need honesty in this work. And you need to build your staff capacity in the social determinants of health. Last slide, I hope. Yes. Thank you for inviting me to Cleveland. I actually really love Cleveland. And I am going to be following the work that you do here because I think that there's a lot of potential here that I don't have in Alameda County and I haven't seen in other places. So I anticipate that we're going to be hearing a lot from this part of the world about how to do this work. Thank you very much.